Women, are you in your 50s? Then listen carefully. One single disease is weakening your bones without much symptoms until one fall, which can lead to fracture. By then, it may be already osteoporosis. But the good news is that you can start protecting your bones even if you are in your 30s and 40s. First of all, start maintaining a healthy weight. Extra body weight puts pressure on your joints like knee, hips and spine. So start keeping a weighing scale at home and check your weight every month. Small weight gains are easier to reverse compared to overweight of around 10 to 15 kg later on. Next, walk every single day. Walking is one of the simplest weight-bearing exercise you can do every day. It helps preserve the bone strength, improves balance, and keeps your joints mobile. Aim for at least 30 to 40 minutes of walk most of the days in a week. Next, protect your joints. If you already suffer with knee pain, avoid sitting in deep squats for a long period of time. Reduce unnecessary stair climbings and wear protective foot supports, and try to prevent falls as ligament injury can affect your joint for years. Next, build muscles with strengthening. After the age of 35, you start losing muscle mass every year and thereby protect your bones. Strong muscles act like a shock absorber. They reduce the stress on ankle and knee joint and thereby protect your bones. Include strength training and resistance training exercise at least 2 to 3 times in a week. Do exercises which mostly strengthen your hip and leg muscles like sit-ups, squats and wall sit. Coming to the nutrition, get adequate amount of vitamin D, calcium and good quality protein in your everyday diet. Your body cannot absorb calcium properly without adequate vitamin D. Spend some time in the early morning sunlight for better absorption of the calcium and take a calcium-rich food like dairy, soy milk based like tofu, tempeh, and millets like ragi and sorghum, sesame seeds and green leafy vegetables. Get your vitamin D levels checked, and if you're at risk, please take supplements as per your physician advice. Last one is the most important point, that is control your diabetes and don't ignore the pain. High blood sugar can weaken down your bones and slow down healing. So if you develop persistent knee pain, have difficulty to walk, swelling around the knee joints, don't ignore it and go for proper treatment, because early treatment gives much better result. So your bones are your lifelong support. The habits you start developing in your 30s and 50s can help you out in your 50s.